presidential candidate Yumin Yeh. It's a pleasure to have you here. We really appreciate your commitment to educating the general public about these candidates and their platforms on most of these pressing, very important issues to our fellow Americans. Please also feel free to help yourself to healthy bars. We're all about health. It seems like Governor Yeh has been traversing around the globe. He's been busy with his Listening for Results tour. He has recently spent considerable time meeting with nurses and doctors. I'd like to take a minute to introduce you to candidate Yeh, Governor of California, and also what brings us here today. Governor Yeh grew up in suburban California and lived in the rolling plains of Texas for several years. He attended grad school in Boston, Massachusetts, and he has been exposed to very different corners of American life. He has always stayed true to his roots and the values that were instilled in him as a little child. The son of a teacher and an engineer, the grandson of small business owners, Yeh grew up in a middle-class family that deeply valued the importance of giving back to their communities. From a young age, Yeh spent much of his free time doing public service work. This included working with disabled communities. He was mentoring local youth, many of them who had families that struggled with their health. During these experiences, he saw firsthand the importance of high-quality health care, as well as the devastation that comes with the lack of access to health care and education to making healthy choices, all of which he will be talking about today in this press conference. As many of you know, Yumin Yeh became the governor of California at the age of 30. He served 2 terms, successfully reversing trends of rapid decline in employment and education. As governor, he pioneered an innovative approach, many approaches, to resource management, and enabled California to become the very first state in the nation to link performance metrics to a state budget. Yeh also pioneered a community health network across California, successfully increasing the health of his constituents. On average, he cut emergency room costs by 28%. He also decreased the wait times by 35%. Today, Yeh is running for the President of the United States. He is committed to bringing an agenda of innovative reform, results-oriented management, and integrity back to the government. Tonight, Governor Yeh will reveal a very critical initiative associated with this health platform. We'll take about 4 health-oriented questions from the audience today after the presentation. And furthermore, members of our team, particularly our health policy advisor, Dr. Caroline Racklin, and Ms. Jessica Harrison back there, who serves as a chief advisor to our candidate, Governor Yeh. They'll be here to answer follow-up questions and also to schedule additional interview times with all of you journalists and bloggers. And with that, I am so proud to introduce our governor, presidential candidate, Yumin Yeh, to talk about healthcare issues and the problems that America faces and his plans to address them. Thank you very much.
Thanks for coming out. Thanks for coming out. Nice to meet you. Hi. Amy, thanks for coming out. Wanted to talk to you for a while. Howard, good to see you. Thanks for coming out. I'm just going to close this door here.
Oh, I think we have one more. Oh, she can go around.
Everyone's back. Good evening.
Good evening.
Great, thanks.
I want to thank you all for coming out. It's very special for me to talk to all of you. It's something very near and dear to my heart. So I want to thank you for making the time to come out. I know it's nice outside and we're really busy, but I want to give you a special thanks. Tonight, I want to talk to you about something that's critical to my healthcare plan. And this preventative care initiative that I'm unveiling tonight is going to be fundamental to how we're going to change America. And it's important to me because it's going to deliver real results for all American people. I was just thinking this morning about somebody I met back in California, and this family was facing something very difficult, but actually something not so unusual. Alicia and her son George were faced with a dilemma. George woke up in the middle of the night, and he had a headache, he had a cough, and he had this unexplainable fever, 101. And the only thing they could think of was, we have to go to the emergency room, for we have no insurance. Unfortunately, the only thing that George could do was go to the emergency room, where they also had no medical records of George, and none of the doctors there have ever seen George before. And to make things worse, George has never been trained or educated in his public school about good health practices and what it takes to have good sanitation and to prevent these type of things. Tonight, because of these dire circumstances that all Americans currently face in our healthcare, we are going to have a new initiative about preventative care that gets to the root of the problem. And this preventative care initiative is going to be made up of 3 key parts. 1 is access. 2 is education. And 3rd is rewarding hospital efficiency. First, let's talk about access. When I talk about revamping access, I'm talking about it on multiple levels. I'm talking about both physical, the buildings itself. I mean, we have easy access to Harvard University Health Services, but not all Americans have that. I'm also talking about electronic access. I'm talking about streamlined network of information so that you can be able to have your medical information with you no matter where you go. This kind of access will provide fast, reliable, and effective health for both the health seeker, and it will also provide more tools for the healthcare provider. I want to tell you what I did in California. As the governor of California, I helped actually start first ever community health center network. And what this community health center network did for the first time is it brought to a local level professional staff and nurses specifically for vulnerable populations such as Alicia and George. And they can assure that our hospital emergency rooms are no longer filled with these non-emergent, everyday cases that are driving up our hospital costs. And we can fix this problem because I did it in California. So if we think about Alicia and George again, under this new initiative, they'll be able to go to this community healthcare clinic, and they'll be able to have fast, reliable, and effective healthcare instead of going to the emergency room where it's not required for them to go because it's just an everyday ailment. Now, these patients' experiences are also made better by greater physical access. Yes, but also, even more fundamentally, we must be innovative, and we must have enhanced electronic medical records. These patient medical records are central to efficient and cost-effective care. So, Alicia and George, when they came to this community health center network, although previously the doctors have seen him 3 times already for the same exact problem, with electronic medical records, what they can do is they can find out that, hey, George actually has been seen 3 times before, and we've given him the same medicines every single time, and it hasn't worked, and thus we need to try something new. And under this new initiative, with these electronic medical records available, we'd be able to have this information and give the right medicine to George. So, we talked about the first point, access. The second point, very important, and this is education. Our children today are flooded with information. Know about Facebook, Twitter, texting, but how come it seems like they don't know enough about their own health? They don't know what really actually will prevent these chronic diseases that make up most of our healthcare costs. Let's talk about nutrition, and this is going to be a central part of my healthcare initiative. Child obesity is an epidemic that is taking over our country. If we don't stand up to this monster now, it will swamp our healthcare system with actually preventable costs. Thus, this idea that thorough knowledge and education leads to smarter decisions leads to my third point. And that is rewarding hospital efficiency. We know that our nations are some of the best in the world, but they can be made even better when we incentivize them for making medical innovations and for having better cost to health ratios. Thus, incentivizing hospitals in this way will actually reduce medical spending because it will entice hospitals through competition to improve their efficiency. We've seen this work in schools, and we can see this work in hospitals as well. Thus, when we rigorously evaluate hospitals on this type of system, which they currently are not, then we will have better health at a lower cost. Let's think about Alicia and George. Alicia and George, under this plan, they can go to the community health center, they can have all the records on file, and they can be able to have the education that they deserve for all Americans. Thus, we must see that this plan must be enacted. And as your new president, I will make sure that this initiative goes through, because this is the type of healthcare that all Americans deserve.